given
Case control.
without breast cancer.
Or
Are you getting my point?
yes.
So this is breast cancer cases.
Two group.
Another group is without breast cancer. So you have two groups. Right?
Yes.
Or you may have here women's with some other disease. Okay? Then analysis of the data showed the following results. Marital status, never married, who are not married. Odds ratio of 4.24. So it's given here. Then it's odds ratio, what should the study? What from you get the odds ratio?
No.
So go to the second year of the
Yeah, we have
lecture
to
to study
study
down.
again.
So you have here cases. These are called as cases. These are called without cancer, are called as controls.
Yes.
So the design
Case control.
is control design. So if the question is asked, what is the design of the study? You should be able to answer that it is a case control design. Then it talks about odds ratio. So you should know what's an odds ratio. If the odds ratio is 1, what does that mean? If odds ratio is more than 1, if odds ratio is less than 1. Go back to the second year lecture, you will find there. So if it's 1, that means there is no association. The two are not related. It does not. There is no association between the two. But if it's more than 1, that means the risk is increased. Now what's here?
More.
More than 1. So that means those females who have never married, who are not married at all, they have 4 times risk of developing the disease. This is development of disease.
Yes.
And what is the confidence interval? 1 point. You are at the confidence interval. And p-value. Huh?
CI, what is
Confidence interval, you don't know
We
yet.
finished the HIC actually, so we know.
So what he's telling me, what's
Yeah,
CI?
we'll go back instead.
I have to go back. It's called as confidence interval.
confidence?
1.70 to 10.57. P-value is p-value I have talked.
Yes.
So what's the p-value here? There are two things. So the p-value you have to understand if it's less than 0.05, if it is more than 0.05. If it is more than 0.05, it means that there is no difference between those who are exposed or who have a risk factor and those who do not have a risk factor. If the p-value is less than 0.05, what is the p-value? Less or more? Less. If it is less, means there are significant differences. Means that those females who have never married have a higher risk of developing breast cancer as compared to other groups. Because we are talking about only never married. So this is one variable we are talking about. So they have 4 times more risk, and this risk is very significant. That means those females who are not married, they have higher chance of developing breast cancer. This is one way, odds ratio. This is the other way.
So the B will tell us about the significance
Significant.
and non-significance.
Yeah, they are significant. Significant is significant not.
Yes.
If it's more than 5, not significant. If it's less than 0.5, significant. That means they have more risk. Non-significant, there is no, this is because of chance.
So we can say the risk is significant.
Significant, they are significantly increased.
Yes.
That means those females who have never married, the risk is significantly increased as compared to those who are married. Is that clear?
Yes.
Now that's the problem, because you have not read your second year all the things you have not revised, and you have come for a revision. That's where the problem occurs. Then another thing, widowed or divorced, or 1.71, again it's increased.
It's a risk.
Odds ratio.
Yes.
So
More than
1.71 times they have more risk of developing the disease.
Doctor, more than 1, it's risk. Less than 1,
That's yeah.
I was liking.
So it's written in the lectures. So it's in the lectures, but now when you apply it,
Apply it more easy.
so apply it. So when you know here, odds ratio is 1, no risk. More than 1, higher risk, there is risk. Less than 1, it is protective.
Protect.
That means it actually protects.
Confident interval, it is the margin of error.
Confidence interval tells you that the risk you see, it is 4, for example, it's 4 point.
I know that. But
I will tell you. In a step, that's what I am telling you. So the odds ratio was 4.2. In order to give the single value, you give a range of values.
Yes.
So you are telling us that this is equal to confidence interval 1.70 to 10.57. So you are getting 4.2, it falls somewhere here. Why we are giving this confidence interval is that if any other person carries out a study, his value should fall between this. It can be anywhere. Okay, so this is a lower range, this is the upper range.
Again, I was thinking, have another name called margin of error.
Yeah. We'll talk later on. Because I don't want to put people here and discuss in that discussion. So margin of error I will not discuss. If you want to discuss, we'll talk.
No, I was reading it's competence.
Interval and margin of error. These are two things. Yeah, but that will tell you some different story. But that story I want to keep for some time here. So the confidence interval, instead of giving this one value, the value is 4.2. It's giving a range of values. It's a range, lower range, it's upper range. Okay? So in confidence interval you have a range, which tells us that your values will fall anywhere between this. If you take many studies, you carry out many studies, the value will again fall somewhere here in the significant range. If in this value, now see, that's the most important thing. If in this value 1.70, 10.50, if 1 falls here, then we are not sure. The 1 is not here. This value, this range of value does not contain 1. Does it contain 1?
No.
Doesn't contain 1. If it contains 1,
Yes.
even though it was giving us a range, but there was also a chance that they will not be having any risk. So the 1 is not included here. Are you getting my point? So as long as you exclude 1 from this confidence interval, that means your study is more
Yes.
authentic. Your results are authentic. Similarly, and a family positive history of breast cancer. So those women who have a positive family history, they are also having.
Risk factor.
So how many times the risk is? 2.95
Almost
times, almost 3 times greater risk of developing cancer. Now another thing I want to talk about here is 95%. In medical science, this 95% is called level of confidence. I have told you,
Yes.
Teacher, I have a question.
Yeah,
Uh,
but it should be relevant, because if it's relevant, we can talk it outside this lecture. You can come sometime to me.
Some website they said we can have 95 level of confidence, but if you have less, some people don't have much sample. So if you increase the confidence interval, you will take 95.
That's what I tell you. That's what I was not trying to tell you. Now you have again pushed the same button. If you have, look, I have a net. I have to catch all of you. I cannot use this much of net to catch all of you. So I have to use a bigger net. Okay, my point? So if I have a bigger net, I can catch all of you. Fish is in the pond. So I want to catch that fish. If I use a very small net, so I want to catch, it is there, it's not here. I want here. So in the confidence interval, look, if I have a large confidence interval, my precision is not good. Precision. Because I'm throwing it all.
Yes.
So I'm not precise. I want a bullseye. I want to fire on a bullseye. So now you are giving me this range. So this is a big margin. So my precision is not good. Okay? Precision is not good. But also the margin of error is less. If I have a big net, less margin, I can catch all of you. But it's not a good precision. But if I use a small net to catch that fish, the margin of error is more, because I will catch it, I will not catch it. But the precision is there.
Yes.
Precision is there. So I know how much I have to make the net cash. So that's called precision. That's what I do not want to talk. Because it is a little bit, you need a further studies for this, so I will not touch here on this. So that was sideway talk, huh? But that's also an important talk.
So 95, what does it mean?
Yeah. So 95% is called as level of confidence. Level of confidence means that if you take many studies, similar many studies, 95 times your value will fall within this confidence interval. 95 times your value will be somewhere. Not the same value, but the value is fall there. It may be 2, it may be 4, it may be 9. So what I want to tell you, that 95 level of confidence means that the value, if you take 100 studies, say 100 studies, 95 times, you may get a value that will fall there. Okay?
Fall between the one.
Yeah. So this is called as level of confidence. So what is the margin of error? That's called as level of significance. That's called as level of significance. So it is 5%. So when you develop, this is called as normal distribution. This is mean. This is 1 standard deviation on either side. This is 2 standard deviation. 2 standard deviation. Okay? When you say 95% means the values which you will get, they will fall somewhere here. This is so 95% level of confidence is equal to 2 standard deviations. Is that clear? 2 standard deviations, plus minus. So plus and minus 2 standard deviations. 95% of value will fall here.
2
Okay.
SD.
Huh?
2 SD.
2 SD plus minus 2 SD. 2 standard deviations. Is that clear? Now, this level of, if you get a value here, how much is here now? 95 is here. How much is here? How much is here?
2.5.
2.5, because it's a two-tailed. It's a two-tailed. On this side it will be 2.5, here it will be 2.5. Is that clear? If it's only this side, one tail, then it will be 5% here. But I am putting on both the tails, so it's 2.5% here, 2.5% here. So the error to get a value outside this is only 5%. So the chances to get a value outside this is almost 5%. So if you get a value anywhere here, this is called a significant difference. That means the difference is very, very significant. Anywhere here. If it's here, it's non-significant. If it's here, it's significant. Is that clear?
Outside the standard deviation.
Outside this is called as critical value. I have told you, you will go revise that and you will find it. And this time giving only an orientation, not again going into the lecture and breathing everything out. It becomes very difficult for me. So 95% confidence. So if you have to,
So how will the question will come in the scenario?
so it's like that. I will ask you, what is your level of confidence? What's your level of significance? So you should know that what's your level of confidence? My level of confidence is 95%.
Yes.
So what's your level of significance? 5%. That's the error. Error will be 5%. Is that clear?
Yes.
No, very, very simple.
Very simple.
That's why it's application part of it. That was theoretical. That's why I wanted all of you to be here. But because you are not here, what can I do? I feel they already know a lot. Very much more.
95, the level of confidence.
Yes, level of confidence. It's written on your in the lecture.
5% level of
Significance. Most of the time, you use this part in medical research. Sometimes you use 99% as level of significant confidence. So margin of error is or level of significance is 1%. So in medical science, you use either this thing or you use this thing.
This is it.
So then this is equal to 3 standard deviation. So how many observations are within this?
3.
Within 3 standard deviation, how many observations will fall?
99.
99%. And between 1 SD?
2.
68%. From here to here, it's 95. From here to here, it's 99. So you have 3 lines. 1 standard deviation, 2 standard deviation, 3 standard deviation. Is that clear? So that is how. So level of confidence 95%, level of significance 5%, or you can have a level of significance, level of confidence 99%, and level of significance will be 1%. Okay? Then you will say, if you use this one, so you will say that 99 times my value will fall there. If it falls outside, there are only 1% chance, very less chance to have a value outside this limit. And if you get a value outside this limit, that will be significant. So you write P is less than 0.01. Now this will be not 0.05. Because it's 1.
Yes.
So P will be less than 0.01. And here, if you are 95%, P less than 0.05. That will be significant. If you get a value here, it will be significant. This will be 95%, 99% confidence interval. This will be 95% level of confidence. Okay? Is that clear or difficult? Finished? Now we will see what will be the questions. We are just talking about that how we have to analyze this whole situation. So, then the scenario, you have this thing in mind. So you have read the scenario, what does this tell us, what is the level of confidence, what is the significance, everything it tells us. Then you will have to answer those questions. What's the question? What's the design of this? So you can read it out now.
Yes.
Okay. What are the types of bias that can occur in this study? So you have to read your study on case controls. We were talking about bias.
Yes.
So bias and confounding are two different. So you will go back and see that what are the types of bias. You may get a selection bias. You may get interviewer bias. You may get a recall bias. You can get confounding. You can get a measurement bias. So it's given there. Eh? So from there you will see if my design is a case control, what are the biases? Or what are the... Now another question may be asked, what are the advantages and what are the disadvantages? Again you will go back to the cohort study. In the last slide, it talks about the advantages and disadvantages. Are you getting the point?
Yes.
Is it easy or difficult?
Yes,
It's very easy. Huh? You have to just go through the lectures but focus.
So any calculation?
Write comments on your results. Now you have the results. How will you comment on this?
Like what we said now.
Those ratio.
Yes.
So you will say,
Yes.
yes, those women who are not married,
Yes.
who are widowed or divorced, and who have a family history of breast cancer have a higher risk of developing cancer. So finish that the comment.
Yes.
Because you see the odds ratio is more and more all the time. So is it difficult?
No.
No. Well, let us see that. Huh? Let us see this in the exams now.
This is the lecture, the exams, all this is different.
Doctor, how can
But it will come the same way. I cannot use this question, I must use some other question.
what can we say in the comment? Just
In the comments, you have to write a comment. So in the comment, you will write, as Abdullah said, that
What you
females
understand.
who have never married, who are widowed, you have also show more, and who have family history, they have higher risk of
translate the result from the number to the انت بس ترجم الكلام هذا من
ترجم الكلام. Exactly. From number to words.
Yes.
Very simple. Now, what are the advantages of this strategy? It is easy to conduct. It gives faster results. So you should go and read it.
revise
Revise the lecture.
Doctor, can you ask about formula or calculation?
Yes, why not? Well, obviously. Oh,
Yes.
yes, that's I see. Now,
The difficulty is design.
everyone has 5 marks, huh? So we can lose 5 marks, but you can earn other marks. Now here's another scenario. You may be given a scenario. Like a study was conducted on diabetic patients. And what was their age? That means this is basically to see the effect of olive oil on blood sugar. So you are doing some intervention. So this study, first from looking at it, it looks as an experimental study.
Yes.
or a controlled, randomized controlled study from the top of it. So you need not to go into the details. It tells us. Then, in the randomized controlled study, we should understand that how we carry out this randomized controlled study. The first step is that who are the people? So, we can see what the eligibility criteria for those who will come in our study. The first eligibility criteria is age. Second, they should be diabetic.
Yes.
So we have the eligibility criteria for this study: age
And males.
and only males. Yes. So we have our three eligibility criteria for that. So in a randomized controlled trial, when we find it's a randomized controlled trial, we should immediately remember that in randomized controlled trial there is something called as eligibility criteria. So what is the eligibility criteria? Age, gender, third, diabetic patients, fourth, these patients should not have any diabetic complications. So these are the criteria for people who will be included in this study.
Yes.
Okay? Then they were divided into two groups. So we should understand that how we do make two groups in randomized controlled trial. How we make two groups. So we do a process called as randomization. So it is Maran, don't sleep. You'll forget one. One group received the standard treatment. So that means we have received the old treatment. Standard means the old treatment. And the second group received the olive oil. So we have two groups. One group received the olive oil, second received the old drug. So this group, which is receiving the new drug, because we are trying to see the effect of this drug, not the old drug. Old drug already we know.
Yes.
So when we are using this olive oil, so this will become my experimental group.
Yes.
This group will be the control group, who are already on the previous drug. So they will be called as the control group. This group will be called as who received this. If I have another group who do not receive this drug, but they receive only some vitamins. So they are not receiving the drug for blood sugar. They are receiving some other tablets. What's that group called?
Experiment.
Huh?
Experiment.
No. Experiment is this. We do experiment on olive oil. The previous is called as control. The new group which received this one, experimental. Now I have third group.
Placebo.
Yes,
Placebo.
placebo. So they are not placebo. So we have three groups. We have either two groups: a control group, an experimental group who receive a new drug, they receive the old drug, or we may have a placebo. That means they do not receive the drug, but they receive the vitamin tablets, so that they will feel that they are also receiving the drug. Then we will see that is there any psychological effect on blood sugar. Because now they also think that we are taking drugs, but actually they are not taking.
Yes.
So we have to compare this one with this one, this one with this one, to see that how does it happen. You are getting my point?
Yes.
Anybody have any problem?
No.
So let's see. It was a double blind. Now, I have to understand, when it's a blinded study, it means it's an RCT now. It's confirmed. From here, it's confirmed that it's a randomized controlled trial, RCT. Because in RCT, only in RCT you do blinding. Randomized controlled trial. So you do blinding. This may be single blind. This may be double blind. This may be triple blind. In single blind, we have our three groups: experimental, control, and placebo. So you have divided these by a process called randomization, but these groups do not know to which group they belong. That means the participants does not know whether they are in this group, they are in this group, they are in this group. The person who receives that new drug, olive oil, old drug, or placebo, they do not know to which group they belong. This is called blind. And when they do not know, this is called single blind. The double blinding is called when the participants do not know, and the doctor who gives them medicine, he also does not know to which group this person is belonging to experiment. He doesn't know that whether this is belonging to control group or experimental group. So you are blinding him. You know blinding?
Yes, yes.
This is called double blind. So the participants do not know, the doctor does not know. This is called as double blind. And triple blind is where even the researcher who is analyzing it does not know. Because in analysis, if he knows that which group it belongs, he may do a fiddling with the data. So he also does not know. So then we call this a triple blind.
How we know? Then after that,
I am a researcher. I have put this as my doctor. So we have patients. He is doing his job. He is giving them medicine, but he does not know whether I am giving this person olive oil, I am giving tablets, or he doesn't know. I know. And the participants also do not know. The person who will be analyzing it, he also does not know. Oh, I know him.
I was thinking the research.
Nobody knows, huh? It's not like that. That's good. Good clarification. So somebody knows. Somebody knows. And that person should not be involved here. Because if he gets involved, then it may lead to bias. So blinding is one of the methods to prevent this bias. Okay? Then,
So doctor, patient doesn't know, doctor a single blind. Patient and doctor double. Try a researcher.
analysis of results, who goes for analysis of results.
The third one, trouble analyzer, doctor, patient.
Statistician, you can say statistician, or who takes observations. I will tell you. I will tell you how that, what that is. Let me give you an example, the weight. He's a patient, he doesn't know.
Yes.
He's a doctor, he doesn't know to which group he belongs. Now, I was using a drug to see the retinopathy, blood sugar. So he is the doctor, he takes the measurement, he sees. He doesn't know whether he belongs to control group, he belongs to, so he doesn't know. So he will make his observations. Then he will give it to me. So this person does not know, this person does not know. He doesn't know which he is seeing, whether he is seeing a normal person, a person from the control group, a person from this group, or that group.
The patient he know enter the research, but he doesn't know
Which group?
Yeah, which group.
So
The doctor doesn't know,
Yes.
and the person who takes the measurement does not know, or the person who analyzes,
Yes.
that is a biostatistician, he doesn't know. Then we call it single blind, double blind, triple blind.
Yes.
Is that correct? Simple now.
So in the word, what does it mean? Analyzer or
You can see
collector or
single blind means when the participants does not know to which group they belong. Double blind means the participants as well as the doctor in charge does not know to which group they belong. The third part is when the blinding is taken far behind. Now far behind it may be the second doctor who takes this or the person who is a biostatistician. It may be anyone.
Yes.
The third. So when it's taken beyond the second level, we call this triple blind. Is that clear?
Yes.
Now he says mean blood sugar was estimated from both groups. So when they give one standard drug, another olive oil, they will see the effect on the blood sugar
Yes.
and they will compare it. Now which is more effective? Is the olive oil more effective? Is the old drug more effective? When they compare, they will find that which one is effective. Now, question will arise. We are talking about the mean blood sugar. Now understand, mean blood sugar. What is the test which we use?
Like quantitative or qualitative?
When we are talking about mean, we are talking about a quantity.
Yes.
So it will be a quantitative test. Quantitative test to see the difference, significant difference. But if there are only two groups, now look, we have experimental group, we have olive oil group. This is the standard group or control group. This is the olive oil or experimental group. If they compare only the means of these two, mean, what is the test they will use? Which test? You have taken this lecture.
Yes.
So, if they are checking the mean between two groups, they will use t-test. But this test will be unpaired. Okay?
Yes.
Unpaired t-test. If there is only between two groups, two different groups.
Yes.
If there is a placebo group also,
B.
they want to say this one. So which? Now there are three means. How they will check it?
detectors.
How the pair? It becomes ANOVA, analysis of variance. Okay? ANOVA, analysis of variance. So this test will be used. If there is only two, then unpaired t-test. Now what is paired t-test? That we also should know. If they want to compare this olive oil, before giving olive oil, they have a mean blood sugar before, and then they have a mean blood sugar after. So before they have a mean, after they have a mean. But this is on one observation. So this group, before taking olive oil and after taking olive oil. So they are comparing two observations on one group. One group, then you use paired t-test. Okay? So it's simple but difficult.
So ANOVA between three tests?
More than two groups. But
Yeah, more than two.
more than two groups, but if it's a quantitative oil.
Between two is the
Unpaired T, not T, unpaired T. If you write T, it doesn't make sense. It's an unpaired T. If it is one person, for example, me, before and after. So, two observations, one group. Then it's called as paired T test. Then you will apply a test of significance called as. So, we have got, when you think about a pair, you should think one person or two observations. Or one group, two observations. But whenever there will be two groups, mention two groups, then it will be t-test. When it's one group, before and after, it will be paired. Is that clear?
Yes.
Clear. Very good. Now this is about the quantitative one. Now if you have a qualitative one, okay? Now whenever you will be having a qualitative one, for example, smoking status among boys, students, and girls students. How many of you are smokers and how many of the girls on the other side are smokers? Now, I am only saying presence or absence of smoking. Presence or absence of smoking. I am not measuring it. Only saying whether they are smokers or not. So what test is called? The qualitative test. So whenever you are having a qualitative variable, you will use a qualitative test for that. And what's the test called as? It's called as a chi-square. So which test we will do for the qualitative variables? Chi-square. Is that clear? Chi-square. C-H-I, chi. It is chi, but you call it chi-square. In Arabic, you have cough and the small cough. One is called as cough.
Yes.
Another small cough.
Yes.
Is there small cough in the letters? Yes, there is. In Arabic, isn't it?
There is no small.
No, small.
Qaf.
Just one part.
This is cough and this is another cough.
Yeah.
Cough, yeah.
Big difference.
That's what I'm telling you. I have a very poor in pronunciation, but I know that there are two things like this. And if I tell you, in Urdu, you have the same thing. Cough, and this is called as keef. Keef. So this is kai. Not chai square, it's kai square. Is that clear? So should we go to the, now what will be the questions on this? So this is the variety of questions you may get. This is what I'm telling you, variety of questions. But I don't know what follows this. Let me see. What the time, by the way, please tell me the time. 12 or 11?
10 to 12.
11:53.
Oh, 11. Okay. What's the design now? Yes, because if it's on the humans, it becomes randomized controlled trial. If it's on the animals, it becomes an experiment. And the difference. So if the study is done on humans,
Just the name.
it will become the randomized controlled trial. But if it is on the animals, on rats, mice, and other things, it will become experimental design. So there will be a big difference. Now you will say, oh, I have written they are randomized, but it's not randomized, man. They were mice.
Yes.
So you know it. What is the eligibility criteria? So which I was talking about. What was the eligibility criteria of the patients to be included? They should be diabetic,
Age, gender.
age, males,
Yes.
and No complication. Without complication. This was a little bit better. Okay? Then we go down. How are the patients divided into two groups? Why is this done?
Randomization.
So they are divided into two groups by a process called as randomization. Why is this done? Why is this done? Why we do like this?
To prevent the bias.
To prevent the bias. To prevent the bias only on unknown factors. Matching is done on known factors. Age, gender, things. But here we don't know. There may be other factors. That's why we want to randomly go here and go there. So it's done on unknown factors, not on known factors, to prevent the bias. Confounding. What is blinding? And what do you understand by double blind?
Yeah.
Simple.
Yes.
What test of significance will be used to compare the blood sugar levels in two groups?
هذا كود.
Take test. So if it, because it's two groups.
Yes.
If it talks about one group, before and after, they are equal. If it tries to tell us about more than two groups,
No.
what is the appropriate match for the follow? Now I have put some terms here. So this way you will be having your question. So be clear about this. Another thing, I am putting these things and I want you to match this. Cross-sectional study. Here are the matching, prospective study, prevalence study, experimental study, place, person and time, bias, randomization, analytical study. What is this cross-sectional study?
Prevalence.
Only prevalence?
Prevalence.
There may be more than one of them.
Prospective and prevalence.
This is okay. Cross-sectional is also called as a prevalence study.
Analysis study.
It's also a part of
Yeah.
analytical study. So two things are here. So if you have to match, you will write here these two things.
Yeah.
If you write only one thing, you will not get it. Okay, go on.
Analytic and
Prospective, yes. Descriptive.
Analytic and prevalence.
Descriptive.
Person and time.
Yes, person, place and time. Describing a disease in terms of place, person and time, that's called as a descriptive. But I will not put it like that, but it's okay. Case control study.
Match.
Matching, okay? Then
Experimental.
bias.
Bias.
Case control is bias?
No.
Matching is there, bias is there, analytical study is there.
Bias?
Please. Yeah, bias. In case control study, you have a bias. Drug A versus drug B.
Experimental.
Experimental.
Randomization.
Randomization. Is there anything? Yeah. So two things match this one.
Yes.
So it's a very good mental exercise. But if you do not know the terms,
Yes.
you cannot be able to put it right. Comments on the following.
No risk.
No second.
No second.
No risk. So the exposure is, so you will write.
OR, Dr. This.
OR is something, this is RR. You have to read the cohort separately and this separately.
ده حسب معين.
I don't know how many of you want to sit in the class for next year, I don't know, because you have to work hard for this. So related risk is from a cohort study. So if it is 1, it means that exposure does not increase the risk.
Yes.
Then there is another thing. Related risk is 2.5.
High risk.
So the exposure increases risk.
Yes.
Because this is the case control goes from cases to controls. It starts from cases, controls, goes behind. This is called as cause to effect. It won't, it's effect. Effect is the case, development of disease. It goes for the cause, to find out the cause. This is how you do a case control study. Now cohort we do here. Exposed group, non-exposed group.
Disease.
You
Non-disease.
see the development of disease, see the development of disease. Here you calculate relative risk, here you calculate odds ratio, here you calculate attributable risk, here you calculate population attributable risk. From here, when you go forward, so this is called as cause to effect. Because effect is the disease.
Yeah.
So it's going from cause to effect.
It's also the directions.
Direction very important. So we talk about cause to effect, we are talking about cohort study. If we are talking about effective cause, we are talking about case control study. Okay?
Yes.
So here we calculate the odds ratio, here we calculate these three figures. You will go back and read. Okay? You should also read where from we will get cases, where from we will get controls, what are the advantages, what are the disadvantages, everything you have to read. Now there is another thing, as correlation coefficient. What is correlation coefficient? Between quantitative variables, we try to find out any association. The odds ratio, relative risk, or attributable risk, these are basically about the qualitative variables. We try to find out if there is an association, number one, if there is an association. If there is, how strong is the association? Okay?
Yes.
Firstly, for example, we saw 4.2 odds ratio in the previous case. So this was, there is an association, and this is the strength of the association. Okay? Now, correlation coefficient, what is this correlation coefficient? So that also talks about the association, this also talks about the association or relationship. So what is correlation? Now remember, and go and read the second lecture on correlation. Correlation is relationship between two variables. So what we try to find out? Relationship between two variables. But most of the time, both the variables are quantitative variables. Quantitative. You can measure and count. So quantitative variables. Again, it will tell us what is the strength of association, what is the direction of association. So, usually the correlation coefficient, it has a value, please understand, and once for all, it has a correlation. The value we get is called as correlation coefficient. So we calculate this, okay? From here, we will get any value between 1, -1 to +1. 2.
This is a diagram.
Yeah, I have seen
Yes.
the diagram.
Yes.
So it goes from -1 to +1.
Yes.
So it is either -1, it is 0, it is +1. Now I will not write 1. So this is the value.
Yes.
From -1 to +1. So if I put, you get a value of 5. Then what is the association? What is the correlation coefficient?
No association.
False association.
False association. So it's a wrong calculation.
Yes.
Because the calculation has to be between this and this.
Yes.
So you cannot have a value more than this.
Yes.
Okay, if I say that I have calculated a correlation coefficient and it came out to be 20.
False.
Yes.
So it's a wrong calculation.
Wrong association.
There will be something in the MCQs as wrong calculation. I'm not going to put it, please. Don't rely on it, but that will be a wrong calculation. So we can have a minus, a positive correlation, a negative correlation. Oh, sorry. So minus, no correlation, or a positive correlation. This is called as no correlation. If you get no value, if you get a plus value any time, this is called as positive correlation. And if you get here, it's called as negative correlation.
If one, it's
Abdullah, where are you going?
But
No, wait. Wait 3 minutes. Then you will leave. Because this is important. I don't want anybody to miss this. So this is correlation. You have no correlation, you have positive correlation, or you have negative correlation. Is that clear?
Yes, that's the one. You read it one or positive, but less than 1 or 1.
So the correlation tells us the relationship between the two variables. Is that right? For example, many of you, when you tomorrow become doctors, inshallah, then you will see the flues is very less. So you will say, oh, very good. This one I will go for a business. Most of you, many people in the higher levels, they also have left the jobs and doing some other private job. So they will be very interested to see, for example, you had a McDonald's, which was very recently opened here. McDonald's.
Yes.
yes.
So what did they do? Firstly, they started something called as advertisement. Why? They want to increase sales. Isn't it? maybe tomorrow you may also open some outlet, you may see that if I do advertisement, does it increase my sales or not? If it increases your sales, which correlation is this?
Positive.
Positive correlation. So there are two variables, one X variable, there is one another variable. If you change this variable, you can predict, you can change this variable. This variable changes on this. But you have changed one, the other automatically changes. The variable which depends on the first variable, this is called as dependent variable. This is called as independent variable. Is that clear?
Yes.
So if you change the advertisement, what happens to sales? If you increase the advertisement, what will happen to sales? Increase. It's going to increase. So if you want to see McDonald's advertisement, which has increased sales. Okay? So they are spending money on this.
Yes.
But one time they reach, then there will be no increase in sales. Because when everybody will know about this McDonald's, that's why you want to tell people about McDonald's. People do not know. So that was sales were increasing. Now everyone in job knows they have done a good advertisement. Everyone knows. So the sales will increase to a point. Then there will be no effect on sales. Because those people who want to go will go.
Yeah.
Those who do not, who want still the Harfi, they will go to Harfi.
They will not care about it.
So they will not care about.
Now
So
zero.
firstly there was a positive association. Now there is
Zero.
no association.
Yes.
Is that correct?
Yes.
Yes. Abdul Aziz.
Yeah,
Easy, it's pretty big.
It's easy.
It's very easy. Very good. Now the point here is,
If you more and less.
so when they find this no association, they will not spend the money here. They will spend the money on some other. Similarly, when tomorrow you will be in the business, you will see, then you say, oh, there is no fun. Is there any correlation? Yes, there is correlation, so you are spending. But point will reach, there will be no correlation. Why I am spending here?
Yes.
I will do so. Is that clear?
Yes.
Now let's see in practice what happens. So this correlation you usually present by two things. Either you calculate equations or you do it by graphs. So correlation is done either by graphs or by, when you do it in graphs, this is called as scatter plot. I have shown
Question
you.
come last year. Question.
Huh?
Question come last year, right?
It has come last time?
Yes.
Okay. So that's fine if it comes. And then you can also have, so graph will tell you, so we'll have an x variable, then this is called as a dependent variable, y variable, which depends on the change of this.
Yes.
So if you see the changes are like this, if I give you a data and you have to check it, so you may get this one, like a graph here. That means if you change this advertisement by 10%, your sales also increase by 10%. If you increase by 20%, this also increases by 20%.
Equal.
Equal. When this equal occurs, you will get a straight line. This is called as, is this positive or negative?
Positive.
It is positive, positive correlation, but it's called as perfect positive correlation.
So,
What's it called as? Perfect positive correlation. Now,
It means
when
one.
equal change. When there is one, you change some part in one, there is an equal change in another variable. Continuously, this is called as positive correlation, but if it's equal change, then it is perfect positive correlation. Now, sometimes the correlation may be this one. You change here by 10%, other change by 2%. You change here by 20%, other change by 4%. So you will not get a straight line, instead you will get something like this. What's this correlation?
No.
It's
It's
increasing.
easier.
It's increasing or decreasing?
but not perfect.
But not perfect. So it's a positive correlation, but not perfect. It's a positive correlation, but it's not a perfect positive. It's not a straight line. Is that clear? Simple or difficult? Now, there are other things which can happen. So this is perfect positive correlation. The value is +1. This is perfect correlation. So the value is not +1. Somewhere between maybe 0.3 to 0.9, anywhere, 0.1, 0.9, but it's not exactly 1.
Yes.
If it's 1, you will get this one, but if it's not, it may be here somewhere. So you have to read from the chapter what's the weak correlation, what's the strong correlation, what's the perfect correlation. You have to read. So this is one part.
Why it's go like that?
Yeah. So you change it, but it does not change equally on the other side. That's it. So same thing happens to various parameters in the body. That's why I want to put it like this. Now sometimes what happens is that, look, if you want to, this is one variable, this is another variable. You see this is x, this is y, okay? Sometimes when you change one by 10%, the other also decreases by 10%.
Basic negative.
That means if you increase one by 10%, the other decrease by 1%. The opposite.
Decrease.
So you increase one, the other will decrease.
That's negative. Please.
Negative.
So it will be negative. Okay?
If it was there.
If it's an equal,
Basic.
but if it's not equal,
Negative.
it means negative. It will be negative, so the graph will be like this. Okay? Is that clear?
Yes.
Good. Don't sleep. If you do not understand, tell me. Then you may have like this.
This is something
More
outside our study.
correlation.
Huh?
No correlation.
No correlation. Not wrong, but it's no correlation. So you see, the graphs.
This is the above negative and
This, if it is like this, straight line, equal change,
perfect.
perfect negative. That is -1.
Yes. It is not
Perfect, then it's negative correlation.
negative.
Is that clear?
Yes.
No difficulty? So easy, no? But you don't read it at the proper time. That's why it becomes difficult. So you have to go back and you will see. So this is called as correlation. So it runs between -1 to +1. It's not -1 or +1.
Yes.
It runs from -1 to +1. But if it's minus, if I say perfect negative and perfect positive, then it may be -1 or. So there is a difference between or and to. I say it runs between -1 to +1. If I say what is a perfect positive and perfect negative, perfect positive may be +1 or perfect negative can be -1 when it's called perfect.
Negative.
Then there will be or.
Yes.
This is 2. So you have to understand the terms here. 2 or what's written?
So two, it's me.
It means the range where it's from. So this is about the correlation coefficient. I think I have done the justice a little bit, but I have done. I try to do my level best to help you. So the word positive, the figure positive gives the direction, and the value gives the strength. Whether it's positive, how much, weak, perfect, or moderate. The correlation coefficient 5. What will it wrong calculation. Odds ratio 3.
It's a good.
More risk.
Yeah, not only more risk, it will not fetch you marks. It tells us
More association.
that the risk of development is a threefold
Yes, or more
risk.
time.
Threefold risk. Not all three times. Three times. Or threefold. Okay?
Okay.
Okay, there's another question. So it was to see the coverage of 12 to 24 months old children. So a study was conducted to find out the immunization between this age group and the study was divided into rural and urban areas. Understand this point. It was divided into rural and urban areas. Then the immunization coverage was then assessed. This is snap, simple snap. Now the question is, what is the design of the study?
Kevin. But
cohort.
It's a cross section.
It's a cross-section study. How is the cohort? Cohort means you have 2 groups. In cohort you have 2 groups.
exposed and exposed.
One is exposed, one is unexposed. In case control you have 2 groups. One are case and another is controls. You may have, but see what's the title. The title is about some particular disease. The control may be some other disease. Or it may be normal.
Yes.
So that's the difference. So write down different types of sampling techniques.
Yes.
Randomized.
simple
You
custom
have to
system.
go back and see what are the different samples. Is it simple random, systematic random, stratified random, what type of cases are different there. And what is the type here used? What type of sampling is here? Is it written or not written?
Interview.
From 12 to
No, sampling.
1.8.
Sampling.
It's
Huh?
selective. From 12 months to 24 months.
No, but that's not the sampling.
Random sampling.
Sampling is here.
Rural area.
So they have divided first the population into
Custom.
two. So they have stratified male and female, rural and urban.
Yeah.
Okay.
Yes.
So this is stratified sampling. Now another is this MERS disease. In real presentation showed the majority of cases occurred in the same region. Mostly males in the age group 18 to 15 were affected. The disease usually occurs in December to March with few cases in October. Now what is the question? Write down the time, place, and person distribution of it. Can you write really?
Yeah.
Can you feel it?
The time.
So you said October.
eh,
Fine.
and basically,
Yeah.
the person who
December
has
to March,
Yeah.
as there are, there is October.
The
So
place
this
is
is
represented.
place is Qasim, okay. Persons,
It's
18 to 58.
first, males,
Male between 80 to
18, 15.
yes.
This is how you can fill your question. Write the quantitative data during the snap. What is the quantitative data here? Quantitative, not qualitative.
the age.
The age is only the quantitative data. Okay? Carefully observe the data and answer the following questions. So we have, you can calculate this.
First year.
Yeah.
This
see.
is-
I don't know, you have to calculate it, you should know. For example, in the case control study which I finished, three source of controls or three source of cases.
Hospital, community
I don't know,
hospital.
you have to go and see. Modes of transmission. Write the null hypothesis and alternate hypothesis. I know, you may get a scenario, write a null hypothesis, write a alternate hypothesis. Always understand that if you have a null hypothesis, you will have a sign like this, or you will have a sign this but with equal, or this. It's in the lecture of the last of the Aziz. It's there. It's there in the lecture. So null hypothesis, these may be the signs. But in alternate hypothesis, also called research hypothesis, you may have this sign.
Yes.
You may have opposite this. But there is no equal.
Oh, yes.
No equal. There is no equal with this.
Yes.
Because this is equal. This is less or equal. This is more or equal. Okay?
MCQ.
Well, I can't say that. MCQ, MEQ, long essay question, short essay questions. I can't say this. So you have to understand that how you have to understand a null hypothesis and to understand that. So if it is a quantitative one, and you are asked to write, so you will write alternate hypothesis, that's 0. Then if it is a mean, you will write mu 0. Any of the three signs will be here. Any of the three. It may be this or this. So it depends on what your question is or what your scenario is. You may write this one, or it may be this one, or it may be this one. But equal sign will be always there. And then there will be some value. Okay? For example, if it is like this, it is 34 grams, for example, something has been given, and you are asked to write a null hypothesis, you may write a null hypothesis like this. And then you may have to write an alternate hypothesis or a research hypothesis. So how you will write? I have given it in your table.